Hi everyone, it's December 1st, 2020, and it's otherwise known as World AIDS Day today. It also kicks off the start of Aboriginal AIDS Awareness Week. So in honor of these two AIDS-related days, we're going to dive into a presentation that was meant to be done in person this year, but for obvious reasons can't be, on HIV and AIDS. So if I can just share my screen here. All right. So we're going to take a look at HIV and AIDS, including the infection of HIV, the transmission, protection, and long-term effects. So what is HIV? HIV stands for Human Immunodeficiency Virus. Human means that it affects humans like us. Immuno means it has to do with the immune system, and deficiency means it causes deficiencies or a weakness in the immune system. And then virus it's obviously an infectious organism known as a virus. So human immunodeficiency virus, a virus that affects humans and it weakens our immune system. So our immune system is made up of different types of cells that are triggered into attacking foreign infections. So viruses, bugs, sometimes even allergens such as dust or pet hair. Our immune system says, hey, these aren't supposed to be here, and it attacks the foreign invaders. So it's a body-wide system, and it happens in our bloodstreams. And what happens when HIV infects the body is that HIV attacks some very specific cells that are a part of our immune system called CD4 cells. And it depletes the CD4 cells, so it weakens our immune system by killing off some of our immune cells. And when this happens, someone with HIV is not able to fight off the other infections. So for example, if someone with HIV all of a sudden comes in contact with an influenza virus, our immune system won't be able to fight off the influenza virus as well as it normally would because our immune system is weaker. So people with HIV tend to get sicker a lot easier because their immune systems don't work properly. So HIV is transmitted by blood. It lives in the blood, which is where our immune system is. That's where its target cells are. So it also lives in the blood. It's transmitted by blood and other body fluids that can contain blood. And it requires direct, so blood-to-blood transmission, because it only lives outside the body for about 3 hours. So this means if you're finding a dried blood spot, the chances of you getting HIV from that are very, 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 very low. You need basically wet blood to wet blood transmission. So blood can be transmitted between people in a couple of different ways. It can be a wound-to-wound transmission, so if two people with cuts happen to touch those, that could transmit HIV, but more likely it would be from something like a needle from one person's body into another. And this could be done if people are injecting drugs, or it could also be done if people are getting tattoos and piercings. The other tricky part with tattoos is that if the ink pot between two people being tattooed is not 3 hours between the two people, then there's a chance that the blood from the first person could get into the ink pot and eventually be transmitted to the second person getting tattooed. Other fluids that could possibly contain blood include sexual fluids, so that is vaginal fluid, seminal fluid, and rectal fluid. All of these have the potential to contain blood because those are fairly sensitive areas of our body, and they can tear fairly easily, which exposes blood, and then the blood gets into those fluids and could transmit to somebody else. And that's usually done through unprotected sex, either vaginal or anal sex is a very high risk activity. And then HIV can also be transmitted through breast milk. So people who are HIV positive are encouraged not to breastfeed, just for the baby's safety. HIV cannot be transmitted through any other fluids except for the ones that I just listed. So the blood, the sexual fluids, and breast milk. Things like saliva, tears, sweat do not transmit HIV. HIV transmission requires 3 things. it requires a fluid, a route, and an activity. The fluid is the blood or other blood-containing fluids that I mentioned in the last slide. A route, or as I like to call it, a point of entry, is an area of the body where there's either thinner skin and tears can happen more easily, or a needle wound, some way that the fluid gets into the next person. And finally, HIV requires a specific activity to happen. So activities like injection drug use and unprotected sex are the highest risk activities for spreading HIV. HIV transmission happens through injection drug use and unprotected sex, as well as tattoos and piercings, but it is not transmitted through sneezing, coughing, shaking hands, or kissing and hugging. A lot of people are concerned if they know someone with HIV, if they come into their house, if that's a risk factor, and the answer is no, unless you're sharing needles or having sex with this person, or sharing like tattoo or piercing needles, you're not going to get HIV from your friend who has it and is coming into your home. So HIV in Canada, we're seeing that in Canadians, there's about 61 people per million who have HIV. In Saskatchewan, we're double that national average at about 149 people per million who have HIV. Sask First Nations communities are at a further disadvantage because they are isolated from most healthcare facilities. And we're seeing there that there's 452 people per million that have HIV. So that's 7 times the national average in Saskatchewan First Nations communities. Now, when we look at Saskatchewan specifically, 71% of new HIV diagnoses were linked to injection drug use. So we're the only province in Canada where that's true. In all of the other provinces, some sort of unprotected sex is the main reason for new HIV diagnoses. But we're the only ones that can say that it's because of injection drug use here. As a side note, injection drug use is about 2 times more prevalent in Saskatchewan than it is in the other Canadian provinces. The next most common mode of transmission in Saskatchewan is heterosexual sex. So that's a man and a woman having sex. And then 8% is through homosexual sex, which is man-to-man transmission. Finally, there is a 2% other risk factor, new diagnoses reason for HIV transmission, and this can include things like people having moved from other countries where HIV was more prevalent, and a very, very, very small percentage of this could be mother to baby transmission. So how can we prevent HIV? Well, the first thing that we can do, and this is especially true in most Canadian provinces where any sort of sex is the main transmission of HIV, best thing you can do is wear a condom. Condoms and other latex barriers are the best way to prevent sexually transmitted HIV. Another thing that we can do here, especially in Saskatchewan, is to not share things that pierce our skin. So needles used for drugs, tattoos, or piercings should never be used by more than one person. I know that there is some tattoo shops or other situations that they say that they sterilize needles, but the very best option is to use the one-use needles for anything. There are lots of harm reduction programs in Saskatchewan where you can get brand new needles. If you do reuse needles, make sure that you are using only the ones that you have used. Mark them somehow, put an initial on them, put a piece of tape on them so that other people don't use your needles and so that you don't use other people's needles as well. Another thing that you can do to prevent HIV transmission is to get tested. If you get tested for HIV, you'll know that you have it. And that way you can ensure that you don't pass it on to other people, including your baby. You can also ask your sexual partners to get tested before choosing to sleep with them. Finally, medications. So if you are HIV positive, you can prevent the transmission of the virus to other people by being on treatment. It's as easy as that. 1 pill a day and you can become untransmittable. So that means that with these antiretrovirals, your viral load, or the amount of virus in your system, is so low that you can have, I don't even want to say it, but unprotected sex with people without the risk of passing on the virus. It's always better to use a condom, especially if these are new partners or partners that you might not see again. But antiretrovirals can get rid of most, and if not entirely, all of the HIV in someone's system. Other medications that are really useful are called PrEP and PEP. So PrEP is a pre-exposure prophylaxis, and this is a pill that you can take if you anticipate that you will be exposed to HIV. So this is particularly good for people who are having sex with a regular HIV positive partner, because there are those people out there who marry someone who is HIV positive. And if they take PrEP, they are protected against HIV in their sexual experiences. Other people who might benefit from this are injection drug users, if they know that they're going to use, or sex workers can use this as well. PEP is a post-exposure prophylaxis, and it's a pill that you take after exposure to HIV. So I don't know how many of you would know about like the rabies treatment, but within 72 hours of being bitten by a dog, or however you're exposed to rabies, you get to the hospital, you get the medication, and this kind of works similarly. So people that this might work really well for are people who accidentally come into contact with a used needle. If you're doing street cleanup and you pick up a needle and you accidentally poke yourself, post-exposure prophylaxis decreases the chance of any transmission of HIV. So antiretrovirals, let's talk about those for a little bit. Antiretrovirals, or ARVs, are similar to antivirals, except that they are a treatment for HIV, which is a retrovirus. So it's just a different type of virus than other ones that require a specialized treatment. So a combination of antiretrovirals is usually what's used to treat HIV infection, and this is called antiretroviral therapy, or ART. ART is used so that the virus is attacked in different ways, which increases the likelihood of killing even the strongest viruses. So this kind of goes back to, I'm sure you've heard about people worried about antibiotic resistance in bacteria. And that concept is that the strongest bacteria among them can evade even some of the antibiotics that we give them. So the antibiotics have no problem killing off the weakest of bacteria, but there's the odd strong one in there that can resist treatment. So we really don't want HIV that's resistant to treatment. So antiretroviral therapy attacks different parts of the virus so that no virus can survive the treatment. If someone's on ARTs, there are people who take what's called a medication vacation. So they stop their antiretroviral therapy. And we really don't want this, because every time that you stop one therapy, you need to be started on a new medication once you decide to start your medication again. And there's only a handful, like a few different antiretroviral medications. So you can imagine that if you've stopped and started treatment and stopped and started treatment, every time you do that, you're decreasing the number of options that you have to treat your HIV. The older antiretroviral medications used to have a lot worse side effects than they have now, including taking multiple pills a day, like a handful of pills. But currently, we have a pill that does it all. So it's just one pill every day, and there's very, very few side effects. So how do antiretrovirals work? At the left there, you can see happy, healthy immune cells. They're just floating along in your bloodstream, doing their thing. But when HIV comes along, they attack and they kill those immune system cells, those CD4 cells. How antiretrovirals work is that they attack those HIV virus particles, and they stop the new ones from forming. So that allows our immune systems to rebuild. When there's no HIV around, the immune cells aren't getting attacked and they can actually replenish. And what's really neat about antiretrovirals is for people who have reached AIDS, which is basically end stage of our HIV infection. So there's a lot of HIV present in the blood of people who have AIDS. Antiretrovirals can reverse this AIDS prognosis. And so you can go from having AIDS to being untransmittable with the help of antiretrovirals. The one downside I would say to antiretrovirals is that they're a treatment and not a cure. So a cure is a medication that's given once for a period of time. And once this period is over, the infection's gone. So you take a pill, for example, hepatitis treatment. You can take the pill for 8 to 12 weeks. There's barely any side effects. And at the end of those 12 weeks, you are hepatitis C free. You have to watch out because there's a chance that you can get hepatitis again. But after the treatment, you are cured of the virus. On the other hand, with HIV, the medication has to be given for the rest of someone's life. Currently, we don't have a medication that's quite good enough to cure us of HIV, but the HIV treatment is really great. There's few side effects. It's just one pill. It just has to be taken every day for the rest of someone's life. Preventing hepatitis C, this slide wasn't actually supposed to be in there, so we're just going to skip that. So we'll talk about prevention through testing here. There are a couple different ways that someone can test for HIV. There are two main ways right now. So you can either get your finger poked, and from a finger poke, either a rapid test or a dried blood spot test can be done. So there's two with just a finger poke. And then there is a full blood draw from a vein, so usually in the arm, that can be tested for HIV. So on testing day, blood is either taken from a vein or finger poke with a rapid test, so one of the finger poke options. You can get the same day results for HIV and Hep C. However, this is only a presumptive test, which means that you need confirmation testing in order to say for sure if you have HIV. The upside to that is that most times that people do this, they'll come back negative and there's no confirmation test that's needed for a negative result, just for a positive. So just a little down the line there, confirmatory test for a rapid positive result. The other option for a finger poke test is what's called a DBS, or dried blood spot test. So that's when you have your finger poked, you touch a paper, a piece of blotting paper 4 or 5 times, and then that dried blood is actually tested for HIV. So I don't know if you'll remember me saying this towards the beginning of the presentation, but you can't get HIV from dried blood spots. The HIV is dead. However, this dead HIV can still be detected by scientists looking to see if there's HIV present. So with dried blood spot, the results take a little bit longer than the rapid test, but it can also tell you if you are HIV positive or negative, and there's no confirmation testing needed for that one. The final option is the vein draw, or the blood draw from the vein. And this is just your standard capsule or tube of blood that's sent away to a lab. They test it for the HIV virus, and results are given in a similar time frame to the DBS, but 1 to 3 weeks, and there's no confirmation testing needed there. So once you're tested, you'll know if you need treatment or not, and the treatment will help protect yourself and others. The sooner that you're able to test and get on treatment, if you need treatment, the better your chances are at having a longer, healthier life, because you can get on those antiretrovirals sooner, and the virus doesn't have a chance to wreck your immune system. We can also prevent HIV through harm reduction. So harm reduction is when we know that people are going to participate in a certain activity, and instead of telling them, no, you can't do that, what we do is we make that activity safer. So for example, we know that people are going to drive every day, but there are certain risks that are associated with driving. So what did we do? We invented seatbelts and a bazillion other safety features that are available in cars. Instead of telling people, no, you can't go swimming, we gave them life jackets so that they could swim. Instead of telling people that, no, you can't ride your bike or your motorcycle, we gave them helmets so that they can protect their head. So harm reduction is basically just making sure that people are being safe, as safe as possible when they're doing a certain activity. So different types of harm reduction include needle exchanges. So if people need to use drugs and they're not in a space where they can quit yet, we give them clean needles so that they're not passing HIV and hepatitis C on to their fellow drug users. Condoms, so people are going to have sex, so we provide them with a safe way of being able to do that. There are also overdose prevention, so like naloxone, for people who have taken opioids and may be experiencing an overdose. Naloxone can save their life. Supervised drug use. So we have this first supervised consumption site opened in Saskatoon this year. Good job, Prairie Harm Reduction. And this is a form of harm reduction because it's overseeing making sure that people don't overdose while they're using, which is really, really great. We also have substance replacement programs. So that's like the Suboxone, methadone programs, where people slowly wean themselves off of an addiction using a less and a less addictive substance that's given by a pharmacy or a pharmacist. Also peer support programs, addictions programs, any of those kind of counseling where you can connect with other people. Those are also harm reduction as well. And just the linkage to care, connecting people with who they need, what they need. Sometimes that's the defining factor in having somebody, turning someone's life around. We know that not all drug users are able or even want to quit using yet. And sometimes a link to care, so housing, can really turn that around. So what happens if we don't catch HIV right away is that HIV progresses to AIDS. So AIDS means acquired immunodeficiency syndrome, which is a really fancy way of saying that basically your immune system is completely shot. It doesn't work. There's too much HIV and it's killed too many of the immune cells where you can't fight off any other infections. So it's kind of funny in a way that HIV doesn't kill you. But what happens is HIV kills your immune system so that other infections can very easily infect and harm you because you can't fight them off. So anyone who dies when they have HIV or AIDS, they die of what's called an AIDS-related illness. So for example, tuberculosis or TB is very, very commonly found with people who have AIDS and is often what causes their death as opposed to the HIV virus itself. Also, like I said, AIDS can be reversed using antiretroviral treatment. So if you do get to the stage of AIDS or diagnosed with AIDS, it's not all doom and gloom. You can get on treatment. Usually, HIV progresses to AIDS in about 10 years, but as you can see, some people are progressed to that stage a little sooner. And some progress a little bit later, but on average, it's about 10 years. where HIV is left alone and without treatment, that's about how long it takes to progress to the stage of AIDS. So in 2018, there was globally about 250,000 people, 3/4 of a million people So 77,000 people who died from what's called an AIDS-related illness. About 40,000 of these people, so over half, were from TB. The remaining 370,000 were from other AIDS-related illnesses, such as pneumonia, meningitis, or AIDS-related cancers. So yeah, actually your immune system is able to fight off some cancerous cells, but if you don't have an immune system, those cancers can definitely grow way faster than what one would expect. But I guess on the brighter side is that since then, since 2018, AIDS-related deaths have decreased by 33%. So about 250,000 lives have been saved each year since 2018. And it's not all doom and gloom here in Saskatchewan. The different stages of HIV prevention, screening, diagnosis, treatment, and viral suppression, they're all looking up. So there has been a 26% increase in harm reduction programs, which allows people to minimize the risks associated with certain behaviors and results in less HIV transmission. As far as screening goes, the very first HIV self-test was just approved in Canada earlier last month now, so beginning of November. It's called the INSTI HIV self-test, and it uses a drop of blood, so it's also a finger poke test, and kind of works similar to a pregnancy test, where your blood goes in, and then you see a line or you don't see a line that tells you if you're HIV positive or not. Like the rapid test, confirmation testing is needed if you get a positive result, but if you don't get a positive result, you're good to go. HIV diagnoses are down since 2017 and 2016 there. Oh, sorry. Yeah, since 2016 and 2017. 2018 and 2019, we've been back to about 33, 32 people per million. So I think Saskatchewan's got around 1 million people, so about 33 people diagnosed in the province per year. Unfortunately, I do have to put a disclaimer in there that we're expecting to see those numbers go back up this year. Because of COVID-19, it's closed a lot of harm reduction programs and really, really prevented the access to programs and to care for people who are at risk of getting HIV. So we expect those numbers will go back up in 2020. On the brighter side though, 96% of people who are diagnosed with HIV are connected to care within a month. So we get them tested and we get them on treatment. In 2016, 77% of people with HIV were on treatment, whereas in 2018, that rose to 79%. And better yet, in 2016, lost my spot there. Here we go. In 2016, 75% of people who were on treatment had achieved viral suppression, which means that they're untransmittable. So they've been on treatment for long enough that they no longer are at risk of transmitting HIV to anybody else. And then in 2018, that went up to 81% of people with HIV are untransmittable and have achieved that viral suppression. So that's really great. Yeah, and then these questions were meant for discussion, but I'll just run through them here. So there's misconceptions with HIV and with harm reduction. So people think that they can get HIV by touching someone who has it, when in reality, there are very few ways that they can pass HIV on, especially if they're on treatment. If they're untransmittable, there's no way. If I don't test positive, or if I don't test for HIV, I won't know I have it and I'll be fine. It's the whole ignorance is bliss that people are using to not test for HIV. But the reality is that the sooner you get it and the sooner that you get on treatment, if you have HIV, the better off your health outcomes will be. And you'll be saving the lives of other people around you that you might be passing it on to. A lot of people think harm reduction is expensive, when in reality, harm reduction is actually cost effective. The average cost of somebody who has HIV over their lifetime, they cost the Canadian healthcare system $1 million, whereas these harm reduction programs operate for far less. Where to test. So we'll talk about community clinics. Your local health nurse or local health clinic can arrange a test for you. You simply have to ask them, hey, can I get an HIV test? And I'm sure the answer will be yes, yes, you can. Larger specialized facilities. So in bigger cities like Saskatoon, Regina, Moose Jaw, there's specialized health and harm reduction buildings where you can get an HIV test, a walk-in one. And a last resort is an emergency room. So like I said, use it as a last resort, but if you really can't find anywhere near you, an emergency room will test you for HIV. And we can link people to other supports. So with mental health, if you have concerns or anxieties about testing, you can speak to a mental health practitioner. If you've been diagnosed with HIV, we can connect you to a counselor who can help you through your diagnosis. Peers count as another support. So sometimes speaking to someone who has lived through it is better than speaking to a professional. There are peer programs all over Saskatchewan. And then finally, addictions programs. So when you're ready, getting help with an addiction might help you better manage your HIV diagnosis and stick with your medication schedule. People who are also battling addictions find it really hard to take a pill every single day and are more likely to take those medication vacations. So if you've been diagnosed with HIV and you're ready for it, and addictions programs would definitely be the way to go. It can also help prevent you from passing on the virus to other people. So I'd usually ask if there were any questions, but since this is just a recording, I won't. You can email me with your questions at cziegler, so CZIEGLER @sktc.sk.ca. A couple websites for learning more. Thanks for watching.